Hi. Have anyone really thought who actually discovered art therapy? How does it evolve throughout history? What contribution does it make to family, societies, and most importantly, individuals? How does it make its way to become a most known approach to address mental health issue, and what does it contribute to mental health professional? Let's dive in more throughout this animation. Today, throughout this animation, we are going to present to you more about art therapy. These are my group members, and we are going to present to you a whole lot range of art therapy. Let's enjoy!
Now I will explain the introduction of art therapy. Art therapy is a form of non-verbal communication of thoughts and feelings that is based on the idea that the creative process of making art is healing and life-enhancing by American Art Therapy Association. It is utilized in a variety of contexts with children, adult, and family to increase self-awareness and aid in emotional regulation. A largely independent assortment of individuals began to use the term of art therapy in their writing to describe their work with clients. These early writers were trained in other fields and mentored by psychiatrists, analysts, and other mental health professionals. The art therapy literature continued to grow. In 1974, Ken Ashman published an annotated bibliography of sources relating to the topic of art therapy from 1940 until 1973. By this pace began to increase, now more than 100 titles available. In 1999 also speculated that art therapy may be more comfortable with an intuitive approach than other mental health practitioners. Art therapy is used with a variety of individual and patient population of all ages and in medical settings ranging from inpatient hospital, outpatient clinicals, and independent practice. According to mental health professionals and experts, art therapy has numerous benefits ranging from boosting self-esteem and providing a safe outlet for your emotion to giving you a sense of control over your life and helping you to get to know and understand yourself better. A UK study of adult mental health during the COVID-19 pandemic has found that more than 50 of 70,000 persons sampled engaged more with the art during lockdown than before.
Next, I will present about the background of art therapy. In the 20th century, the art therapy was only be accepted by the public as profession. In Britain, ANNUAR is an art therapist who is considered by many to be founder of art therapy in Britain because he coined the term of art therapy in 1942. Initially, ANNUAR provided service to the injured soldier who is coming back from the World War, and after that he also has provided the service to normal civilian patients. From his art therapy, ANNUAR discovers that art therapy could help the patient to divert attention, release their stress, and improve their confidence. While in the United States, there are two important art therapists. One is Margaret Nabu. She is a founder of art therapy in United States, and she is the first person describe art therapy as a stand-alone mental health profession. The second important art therapist in United States is Andy Grammer. Although Margaret Nabu and Andy Grammer are both famous art therapy in the early days in United States, but they have the different view on the art therapy. For Margaret Nabu, she views art therapy is a therapy assist in the totality of art psychotherapy experience, while the anti-grammar view therapy is developed from the art product that is created by the client or the patient. There are many types of art therapy. The type of art therapy are included visual art therapy, dance therapy, drama therapy, musical therapy, and the expressive writing therapy.
First of all, the theoretical of art therapy are basic in many ways. Art heals in a lot of ways. First of all, art therapy could promote health. It has been proven to reverse aging as it reduces stress and increase our immune system. It has a lot of benefit to physical and psychological health. Second, art have a multiple access to intelligence. It is no surprise that people with art abilities could imprint visual image in their mind to a literal sculptures and painting. It were known to psychological and philosophical structure. Third, art actually promotes psychological horizon. How does one art actually link to psychology? Well, you see, aesthetic mode has been proven to give high satisfaction of forms to an individual. It actually develop individuals spiritually, intellectually, and physically. Art also allows people to have cathartic release of a pent-up emotion in their mind, which give a very high satisfaction. Eventually, endorphin will release and people are happy. Thirdly, no surprise, art actually expands our horizon of social. We actually get to know more about culture because of our aesthetic mood that we appreciate in arts. With art therapy, we get to meet more people and improve our linguistic skills. This does create a very community effect in our life and help improving our daily life by communicating with others. By communicating with others and expand our states of consciousness in our creativity context.
Now I will continue with the part of dance or movement therapy. According to the American Dance Therapy Association, dance or movement therapy refers to the psychotherapeutic use of movement to promote emotional, social, cognitive, and physical integration of the individual for the purpose of improving health and well-being. This dance or movement therapy is holistic and it is based on the support of the experience proposition that body, spirit, and mind cannot be separated and are interrelated. So, the changes in the body can reflect the changes in the mind and vice versa. Then, in order to treat the patients, this dance or movement therapy will be used by the dance or movement therapist to observe and assess the body language, non-verbal behaviors, and the expression of the emotion of the patients as well as themselves. Then, they will intervene to solve the integration problems of the patients between their social, emotional, cognitive, and physical aspects. The process includes improving the muscular strength, coordination, decreased muscular tension, and mobility of the patients. For example, the dance or movement therapists will use jumping rhythms to dance with the patients to solve their problems. In addition, this dance or movement therapy is usually being used to treat the impairment in physical, psychological, social, and cognitive issues that include cancer, hypertension, anxiety, depression, poor self-esteem, dementia, trauma, autism, and so on. It is normally being practiced in rehabilitation and medical facilities, educational and forensic settings, nursing home, daycare centers, disease prevention, health promotion programs, and private practice. Besides, this dance or movement therapy is usually for all people, and through this therapy, it can effectively help the patients to enhance their self-esteem, self-awareness, and body image. It can develop effective communication skills and relationship of the patients, expand the movement vocabulary of the patients, understand deeper into the behaviors pattern, and create new ways for the patients to solve their problems. The next type of art therapy is musical therapy. According to the American Music Therapy Association, music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professionals who has completed an approved music therapy program. The healthcare and educational goals of music therapy include well-being promotion, stress management, memory enhancement, expression of feelings, communication improvement, and so on. In order to help the patients, the music therapist will assess the information of the patients to select the appropriate types of music therapy service that is suitable for them. They will make a plan according to the needs of patients, implement it, and evaluate the response of the patients to the music therapy treatment. The example of music therapy types include songwriting, lyric discussion, music and imaginary, singing, music performance, music-assisted relaxation, electronic music technology, receptive music listening, learning through music, and so on. Moreover, this therapy is suitable for all people, and it has been used to treat the patients who have trauma, autism, Alzheimer, anxiety, depression, stress, pain, physical illness such as cancer and headache, mental health disorder, and so on. This music therapy is normally practiced in development, rehabilitative, medical, mental health, preventive, wellness care, or educational areas. Through music therapy, the emotional, physical, psychological, spiritual, social, and cognitive areas of the patients can be improved. For example, the patients can release their repressed emotions, reduce anxiety, improve sleep quality, and reduce pain. Next, I will talk about drama therapy. Based on the North American Drama Therapy Association, drama therapy refers to the intentional use of drama and or theater process to achieve therapeutic goals. It is a kind of active and experiential practice that can help the patients to express their feelings, tell their stories, set their goals, solve their problems, and purify their emotions. For this therapy, its theoretical foundations include drama, theater, psychology, psychotherapy, anthropology, as well as interactive and creative process. In order to heal the patients, the drama therapist will assess and consider the techniques that are most suitable for the patients to meet their needs, and they will guide them through the intentional activities for the patients to change their emotional states, behaviors, and skills. The techniques that are used to treat the patients under this drama therapy include storytelling, projective play, performance, purposeful improvisation, distancing, and witnessing for the patients to make meaningful change. Also, this drama therapy is suitable for everyone, and it is usually used to treat the patients who are suffering from loss, transition, isolation, conflict, anxiety, depression, autism, and addiction. This drama therapy is being used in various mental health and community settings such as schools, mental health clinics, nursing homes, and community centers. Through this therapy, the patients can have a positive change in mood, insights, and empathy. The relationship of the patients can be improved and become healthier.
Now I will introduce about expressive writing therapy. Expressive writing therapy is a type of therapy that individuals write about their feeling, their idea, which link with the personally stressful, difficult, traumatic, and past negative experience. There are a few types of expressive writing therapy. One of the type is narrative therapy. In narrative therapy, therapists will request the client to talk about their traumatic experience. After that, counselor will sort, analyze, and redefine the client's traumatic experience so that they can see their own story from more objective point of view. The second type of expressive writing therapy is journaling, and it can be practiced individually and or involve counselor or therapist, which is named interactive journaling. Individually, journaling is a person can write their thought, feeling, and respond in a journal book every day. This can be very private thing, and it can help people to see things in perspective way. For interactive journaling, counselor will provide journal prompts to client, and counselor will inform and analyze their writing. So, they also have other expressive writing therapy type like poetry, storytelling, and dialogue, and humorous stories.
Hi, now I'm going to present my part about visual art therapy. What is visual art therapy? Visual art therapy is a creative method of process in developing self-awareness, exploring emotion, addressing unresolved conflict, emotional conflict, improving social skill, and also raising self-esteem. It is a therapy primarily used to help individuals experiencing emotional and psychological changes, to help achieve personal well-being and higher satisfaction. For the history of visual art therapy, it evolved for thousands of years. Initially, it was used as sacred painting, charm, and symbol, and used as a medium of communication, self-expression during the ancient days. But now, as it evolved, it has been used as self-expression, group therapies, diagnosis, and also conflict resolution throughout history. For thousands of years, culture and religion around the world have been using this art therapy. The next thing is the positive result that can be achieved in this art therapy. Any disease such as psychological issues and also physical issues can be resolved using this art therapy. The psychological issues such as emotional unwell, stress, depression, and also substance dependence could be used by this visual art therapy to help individuals. Next, it also can be used as to cure physical disease such as cancer, heart disease, anorexia, and bulimia. It is actually widely used for hospitals and mental health professionals. Next, the technique that is used in this visual art therapy is versatile for all range of age. For the younger kids and children, mental health professionals tend to use doodling, scribbling, painting, or finger painting for the younger kids. While for the older adults they can use making textiles, potteries, and molding clay into a sculpture. Next, the contribution that are made by a known few historic figures in this visual art therapy, and their contribution are well known throughout history. The first one is Nombre. Nombre believed children who were allowed to express themselves creatively and pursue subject of interest will eventually lead to a healthier development. This healthier development will make children achieve higher satisfaction and develop into a well-versatile person. The next one is Nombre began to view this creative method as a methodology similar to verbal expression. They found a creative expression of drawing to allow family members to better identify the emotional issue or diagnose the issue themselves. She also saw the significant therapeutic benefit of the drawing process. She eventually found her technique are well versatile and well used throughout history. Until now, families, societies, and individuals are still using techniques to actually cure emotional and unresolved conflict.
There are several advantages of art therapy. First, it allows people to express their feeling and emotion using visual art, music, and writing. The color and material chosen in making art can explain the reasons and trauma symptoms individual experience. To make an example, according to Watson 1989, children that suffered from anxiety usually use dark chaotic palette in their drawings to express the feeling of anxiety. It will help to awaken the sense of creativity and imagination of the child to discover himself. Next, it will enable a person to explore their deepest emotions and thoughts about their experience. As an example, a therapist will encourage a patient to write an everyday journal as a diary. It will help in terms of being more expressive of their thoughts and feelings without the need for verbal communication. Therefore, art therapy promotes people to access their own emotions and thoughts without being afraid of the judgment of others, because eventually it will help them to understand themselves better. Moreover, art therapy can improve the social functioning of a person, because art therapy usually conducted in group. For example, in 1994 explained that in drama therapy, the first stage of therapy is where the group members get to know each other, develop trust with group members. So, all the people that engage in art therapy groups can enlarge their social circle and interact with each other comfortably. Lastly, it can reduce stress and anxiety. Art can act as a form of self-care. Whenever individuals feel stressed or overloaded work, it is advised to take few minutes to spend some time drawing or writing poems to help with a sense of calm in the individuals. In addition, music therapy also helps in reducing the heartbeat of an anxious individual. Some classical music, for example, approximates the resting rate 70 beats per minute, can calm a racing heart.
Okay, now I will explain the limitation of art therapy. First, let me clear that art therapy is not the same as attending a regular art class. In art class, the goal is to come out with a finished artwork to showcase. However, in art therapy, the goal is to show the passion, thoughts, and emotion during the process, even without a finished product. As a result, even simple observation may first overwhelm some patients. Furthermore, If the patient has low self-esteem, they may believe that they are not talented or suited to participate in art therapy. Other than that, there are financial disadvantages. When we talk about art therapy, it is costly for patients and high investment for therapists. For patients, it can be costly to consult with a therapy and book session. This job is also expensive in terms of large investment for therapists. A professional license requires them to devote 2 until 10 years in their field of study. Lastly, the limitation of art therapy is poor job growth in this field. Currently, there are some full-time art therapists present. However, not everyone recognizes the value of art professions. They will most likely to try other professions for extra money. They are still relevant to their field of expertise. For example, giving additional counseling.
In conclusion, art therapy is a form of psychological treatment approach to the creative process. It allows individuals to express themselves through the form of drawing, acting, writing, dancing, singing, producing music, and painting. It helps in healing adults that experience severe stress, children that have social problems, children with learning disabilities, and people with mental health disorder. It does not need an individual to be artistic or have special talent, but it values the participation, progress, and benefits an individual earn from it. Clients will have a moment to focus on their own feeling, perception, and imagination. Art therapy is accessible to people of all ages, thus, people can undergo the therapy even if they have no talent in art, as long as the goal is to be a better version of a person itself. Hopefully, by practicing art therapy in this society, people are able to heal themselves, believe in pleasant lifestyle, and healthy well-being. That's all.